Hey guys, this is Thomas Wells, founder and CEO of The Body Mechanic, and I wanted to show you today a couple stretches and mobility exercises for the sacro-iliac joint, which is the joint in the back where your spine and pelvis come together right there. You have one on the right and the left. And this kind of piggybacks on with my last video, which was showing sacro-iliac gapping, which is another stretch for the sacro-iliac joint. So there's going to be kind of one stretch and one mobility exercise or mobilization for the SI joint. This is for people who have compression at the SI joint. So usually when people have sacro-iliac pain, which is what most people describe, most people who report having back pain, what they're really describing is sort of sacral pain, sacro-iliac pain. And they'll often point with the back of their hand to show the area where it hurts. This is for when that joint is compressed, when it's too tight, not moving enough. That creates a lot of pain, and these stretches and exercises I'm going to show you can be really helpful for that. This is not for if that joint is too mobile, because that can create a lot of similar pain too, except if you were to try these exercises, you'd actually find that they had a negative effect, that it actually made your symptoms worse. So I just wanted to lay that out up front. So the first one I want to show you, this may look familiar to you. It's a version of a very common type of hip and SI joint stretch, and this is called the 90-90 stretch. So the 90-90 stretch, you're going to get into this position here. So the 90-90 refers to the angle of the hip and the knee, not the two angles of the legs. So you want about 90 degrees relative to the angle of your body at the hip here. So it's flexed 90 degrees and then 90 degrees at the knee. And you're also actually externally rotated 90 degrees as well. The back leg is just out of your way. So what exactly you do with the rear leg doesn't really matter in this one. And what you're going to do is you're going to square your body towards the front leg. You're going to sit up nice and tall. And then you're going to lean forward from the hip. So you're going to keep your back straight. You're not going to round your back over. It's not about how far forward you can get. You're just going to bend at the hip joint, just like this. And you'll feel that stretching kind of all around the hip joint in the hip rotators. You'll feel some in the adductor muscles, in the hamstrings, the outside of the hip. Those are all good areas to feel this. So you're going to lean forward, and when you reach the end of the range, you're just going to take a nice diaphragmatic breath. That's a belly breath. And you'll notice as you exhale, you're able to sink in a little further. And then you come out of the motion and repeat. Just take a diaphragmatic breath. You'll sink in a little bit more on the exhale, and you come back out. You're going to do that for about 12 repetitions. Once you've done that, then you're just going to switch sides, which is as simple as that. 90 degrees knee, hip, and rotation. This leg out of the way. Square your body towards the front, and just lean in like so. Okay, so you can do this multiple times a day. There's not really an upper limit to it. Some people, particularly those with a history of sciatica or sciatic nerve tension, might notice that they feel a little numbness in their feet when you do this. As long as you're not holding the position too long, that shouldn't be an issue, because it'll only be a couple seconds at a time that you're holding this position. But if you do notice any sort of progressive numbness, like that doesn't go away as soon as you get out of the position, then you would definitely want to skip this one. So the next one I'm going to show you is called, or at least I call it, the windshield wiper. And this isn't so much of a stretch because you're not really holding a position. It's really just a motion to help mobilize that joint. As they say, motion is lotion. So there's a good way of creating some mobility in there. So for this one, you're going to be face down with your arms just out of the way, knees bent 90 degrees, and you're going to rotate the legs side to side like so. Okay, so you're just internally rotating, externally rotating, internally rotating, externally rotating. And you're just alternating which leg is in front each time. So every time you internally rotate like this, it helps open up and separate the SI joint. And as you externally rotate and bring the legs together, it helps close the SI joint. So helping just go through this opening and closing motion like this really helps bring some circulation into the joint, helps the sacroiliac ligaments loosen up, and it can really create some good mobility. And if you're going to be doing any kind of more intensive mobilization through the pelvis or the hips, this is a really good warm-up for that. This is a really good movement prep in general for any sort of lower extremity work you're going to be doing. If you're going to do these the two things I've shown you together, I would probably start actually with the windshield wipers, because you might actually get more range and more stretch in the 90-90 stretch when you do it. So try those out. Again, this is for a compressed or tight sacroiliac joint, not a loose or unstable one. So if you're someone who's been told you need to wear like a sacroiliac belt, for instance, these would not be good for you. These would be the opposite of good for you. You'd be wanting to do more strengthening and things like that. So hopefully you find this useful, and I'll see you next time.